Hi, my name is Julie Miller. I'm a CNEP student at Frontier Nursing University. Today, I would like to talk about just a little 5-minute learning lunch on some evidence-based treatment options for patients experiencing an acute exacerbation of chronic obstructive pulmonary disease that I will now abbreviate as COPD. So if you would allow me just a moment and I will share my screen and we'll get started. This is going to be very brief because we want to keep that 5 minutes. So our patients have many concerns when they are experiencing an acute exacerbation. That we're going to talk about just two of their many concerns, but that are not atypical of patients in these situations. One of the things they're concerned about is the long-term side effects of conventional glucocorticoid therapies. And another one is their concern about needing to be hospitalized for their care and to be away from home. This causes them a lot of stress. Many of these patients would rather be treated at home and not have to be away at the hospital. So we're going to look at two studies that were done that address these two issues. The first one was a small Norwegian study, and they compared two groups, a group that they called hospital at home, or HAH, versus the traditional hospital care that patients receive in these situations. And what they looked at is whether or not the patients felt that they were safe when being treated at home. These patients in the hospital at home group had a really interesting setup. So the nurse would visit them for an hour each day for the first 3 days and help them with their cares and a lot of teaching and helping them with their disease management in their own homes. And they found that the patients did feel that they were safe, and they also felt that the information was adapted to specific situations in their own daily lives, and that it was given in a familiar environment and had a positive impact on their self-management of COPD. The hospital at home group also had a lower readmission rate than the patients who had the traditional hospital care. The second study was a much larger study. 314 patients were randomized. This was a Swiss study, a randomized controlled trial comparing short-term, which was 5 days, versus the conventional therapy, which was 14. And they found that the 5 days of systemic glucocorticoid therapy was non-inferior to the 14-day treatment with regard to re-exacerbation within 6 months of follow-up. And so this also significantly reduced the glucocorticoid exposure. And so these are two small studies, again, and only 2 studies. And so surely there is much more research needed, but it's promising for the options for these patients when we're trying to provide them with patient-centered care and to consider their needs and concerns when helping them through this disease process. And I thought it was really exciting that we could offer them these options that also have been shown to have really good results. So we can give them good care as well as taking their needs into account. Thanks for attending this lunch. And if you want to read more about these 2 studies, I have the articles here. Thank you.